Okay, this video is an update on my treatment and my progress for insurance approvals and what type of treatments I'm going to be having going forward. Now, I should just note that I have been 30 days ago, once I was diagnosed with anti-hmgcr myopathy, non-statin associated, I was put on high-dose prednisone 30 days ago. My CK was at 1,917, and 30 days after prednisone treatment, my CK total is now at 569. So here on August 21st, I was tested at 1900. They put me on high-dose prednisone, and 30 days and 35 days later, my CK is down to 569. Now, they've ordered me IVIG infusion treatments, which is the immune globulin infusions. And my original question was, since I have an autoimmune disease, why do I need IVIG? If IVIG is an immune booster, it helps your immune system fight things. As to where the prednisone is an immunosuppressant, because my immune system is attacking my muscle tissue, which has caused me debilitating severe weakness that has left me completely wheelchair and bedbound. So the question is, why do I need IVIG therapy if it's an immune booster? If we need to suppress my immune system to get my immune system to stop attacking my body, then why do I need an immune booster? And I found the answers here, so it helps me understand why I also need the IVIG. And this is because it's an antibody replacement, so it's going to flush my system of all the bad antibodies, and it says IVIG provides a concentrated dose of antibodies that help the immune system fight infections and foreign invaders. Apparently, this is a good measure to take when you're on immunosuppressants so that you're still able to have some level of fighting infections and invaders. And it also is an immunomodulatory effect. So IVIG can help balance the immune response and inhibit harmful components of the immune system, such as the anti-hmgcr antibodies that are wreaking havoc on my muscle tissue. It also is a neutralization of toxins. So IVIG can help neutralize toxins. Okay? So that's why I'm going to be having the IVIG infusions in addition to the prednisone. Now, let's go up here, and I've made this document on my combination therapy. I'm going to be having the IVIG therapy, as I've said, and explain what that's for. Now, I'll also be get put on, and this order should be put in ASAP. I'm going to be starting these right away. Mycophenolate mofetil. The aim of this medicine is to control inflammation and put the disease into remission. It can be effective in treating myositis that has not responded to other immunosuppressants. It is more often used than steroids, which have long-term side effects, so it takes longer to work than steroids. They also put you on this mycophenolate in order to taper you off of the prednisone, so you don't have to be on the prednisone, which is a whole other subject, because people are worried about prednisone and the long-term effects of it, but honestly, there are long-term bad side effects for the use of all of this medicine that they would have me on. Serious side effects of it all. So obviously the prednisone is one thing I'm on, and then the Bactrim is to reduce the opportunistic infections from being on immunosuppressants. So this particularly prevents me from getting pneumonia and other things related to being on immunosuppressants, because both of these that I'll be on is an immunosuppressant, and the goal is, I guess from what the doctor says, is to taper me off of the prednisone while I'm on the mycophenolate mofetil, plus the IVIG treatment and the Bactrim. Okay, so that's the treatment combination plan that I am supposed to be starting here on Monday. So I will let y'all know how that is. I'm going to be keeping a journal. So let me, if I can find that journal. Where is my journal? Let me get it here. Come on, come on. It's hard to do with this arm. Get all my notes out of the way. Okay, so this is my IVIG therapy journal that I'll be writing in. And you just keep track of how it's working for you, any side effects, and you keep your batch numbers and product numbers in case there's any kind of product recall and all that. So I'm doing that, and I'm also got this comprehensive treatment journal. So not just for the, I have this IVIG journal, but I also have this treatment journal to monitor my combination therapy. Okay, and then the other things are my custom wheelchair has been approved, my shower buddy has been approved, my treatment's been approved, I've had my MRI on my shoulder, and I've had my muscle biopsy. My muscle biopsy had too much fatty infiltration in the area that they took, and they were not able to get any actual muscle, but they were able to confirm, obviously, that there's a myopathic process happening where there's very little muscle in it. The MRI showed that most likely what's going on with my shoulders is due to the rapid progression of my muscle weakness. My shoulders are now partially frozen, like a frozen shoulder. So I'm going to have physical therapy on that and probably injections in my shoulder to get my range of motion back. But it did show further muscle damage, obviously, but there are areas in my shoulders in which they said certain muscles have been spared. So that's good news. So hopefully with treatment, I have enough muscle in there. I can build that back. I can strengthen my arms and hopefully at least be able to stand, take a few steps, and maybe even raise my arms up higher than they are right now. So that's all good news. So yeah, I think I've addressed all that. Yet my prednisone has brought my CK level down. So we're making lots of progress, but there's still a lot to be done. And my next video, I'm going to be talking about the issues that I've had with transportation services.